Bonjour. Good afternoon, Chairman Simpson, Ranking Member Pingree. Thank you for the opportunity to talk to you today. My name is Aurene Martin, and I am here today as Secretary of the Board of Directors for the National Indian Child Welfare Association, or NICWA, and also as the proud mom of 2 adopted children who I was able to adopt through Indian Child Welfare programs, tribal Indian Child Welfare programs. I'm honored to be here today on their behalf to share testimony regarding BIA Human Services programs. NICWA is based, I'm not close. I'm just going to relax. NICWA is based in Portland, Oregon, but our work supports tribal nations and urban Native communities across the country. We focus on strengthening policies and services that improve outcomes for Native children and families. We work in close partnership with tribal nations to ensure our efforts reflect their priorities and their lived experience. At the heart of our work is a simple and important truth. Tribal self-determination and tribal sovereignty are essential to building effective human service systems for our people. While there are many ways to address challenges, the most effective and sustainable solutions are those designed and led by tribes themselves. Many Native communities continue to face serious challenges, including child abuse and neglect, mental health stressors, violence, and substance abuse. What we understand more clearly today is that these issues are often rooted in trauma, both from present-day experience and from historical events that have impacted generations. Trauma has long-lasting effects on brain development, behavior, and overall well-being and health. It's not on my list, but it does. And when it goes addressed, those impacts continue, affecting not just individuals, but families and entire communities. That is why it is so important that services are not only available, but also culturally grounded and responsive to community needs. Across the country, tribal nations are redesigning their human services programs to better reflect their values, strengthen family engagement, and improve outcomes, and these efforts are working. In child welfare, many tribes and urban Native organizations are using Indian Child Welfare Act funds to support culturally based prevention services that strengthen families and reduce the need for foster care. One example comes from the Confederated Tribes of the Umatilla in Oregon. They redesigned their child welfare system to improve coordination, increase family engagement, and better integrate their tribal court system. In retrospect, their changes seem so simple and intuitive, but they did 3 things that I think are really impressive. They switched from being reactive to trying to do prevention to stop things from happening before they happened. They also changed their image. They wanted to make sure that the community knew that they weren't there to take children, to remove children, to accuse people, but to help keep them together. And that helped incredibly within the community. And then they widened the circle. They worked with families, extended family, and brought them into the process to help support the families that they were working with, the smaller families. The result was impressive. There was a 60% reduction in foster care placements. Just as importantly, families are now reaching out for support earlier before situations become a crisis. This is what culturally grounded, community-driven approaches can achieve. When tribes incorporate culture into their service, they strengthen protective factors that help families heal from trauma and build resilience over time. And this work isn't isolated. Tribal nations across the country are seeing similar successes, not just in child welfare, but across human service systems more broadly. The BIA Tuahi initiative is another important example. It supports tribal nations in integrating services across child welfare, social services, housing, and general assistance, helping families access more support in a coordinated and effective way. Red Lake did much the same thing as what Umatilla did with this system, and they were able to reduce foster care placements by 50% and reunifications by 300%. In many respects, tribal nations are leading the way in designing systems that move families towards stability and long-term well-being. Tribal nations are also strengthening state systems. Many tribes partner with states to improve services for Native families. I have experience with that. That's what I did when I was a ICWA worker or ICWA attorney. We provide cultural experience, connections to community resources, and critical context that leads to better outcomes. Like many Native families, my own experience reflects the importance of community, culture, and connection in ensuring children grow up in stable and supportive environments. These connections are not just meaningful, they are essential. When tribal nations have the resources they need, they deliver results. Thank you again for your time and consideration. I'm happy to answer any questions.